This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the Ph.D. doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome. It's Health Watch, another edition right here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly FANTASIA, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. What are we going to talk about today on the show? Well, we're going to talk about the who, what, when, where, why, and how of Innovative Medical, what they can do for you, and how they can help you and your family improve your quality of life. 855-839-1210 is the number. If you have a question or a thought for Dr. Molly, 855-839-1210. That's the number. Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. We say good morning to Dr. Molly.
Hey, John. It's good to be back. It's good to be back live again.
Yes.
Second show.
It's really good because we were getting calls that maybe we retired.
No.
we didn't.
John,
we didn't retire.
You know what, John? You and I are going to retire with our boots on.
That's
you know
right.
That's
right. So no retirement, at least yet. But let's talk about Innovative Medical, how it's different, why people should come to you, and just in general,
Sure.
What's your thoughts?
So Innovative Medical is actually a cooperative of like-minded healthcare providers. And we work out of a licensed facility, which I founded and own. And what we do is we actually do anything that a primary care facility can do. So, you remember the good old days when you went to your corner doc and he gave you what you needed if you had a cold, if you were sick, if you had the flu, you got your shots, whatever. The whole family did. And so we can do all that. We can do every bit of that. But how we are different is in the philosophy of what we do. We believe we want to use the least amount of pharmaceutical necessary to actually help a patient get through their medical challenge and not impede their quality of life from the side effects of the medication. So, for example, if someone comes in, and today we're going to talk a little bit about some other things, but someone comes in and they have hypertension. I'm not going to tell you to throw away your hypertension meds, but maybe we can augment those from things that you might get at the health food store. And that is the key to this.
Yes. You mentioned later on, we're going to talk about something, but it's going to point out, and I should mention this now, you're very thorough what you do.
We are.
I mean, you have discovered things in patients that they didn't even know they had, or they had a problem and they didn't know what it was.
Right.
Talk about why.
That's because of my physicians and my nursing staff. Because, first of all, my nurses and my techs on that floor are always observing. Nurses are trained to observe. Right?
Yes.
And they see a change in color. They see a change in... My physicians know that when they come over and they work with us, and with me in particular, since I'm a scientist, I want to know underlying reasons for why something that a patient has done in the past hasn't helped them. And so we will comb and do the archaeology in their medical records and those kinds of things. That's why it's so important, John, and we'll get to that about the initial free consult when they come in to me. I want to know what it is that some patient wants to effectuate change in. People come in with all kinds of problems, as you know. And most people actually come in who have an open mind and know that what we do is the utilization of the natural products and in a unique way, medical hydration. So they're already aware of this, but they may not be aware of what they need to do. And that both is conventionally as well as integrative.
Talk about the initial consultation and what what you do and really how people should approach that.
Well, I think
and then
it's-
your approach.
Right. It's very, very important that they come in and chat with me for 15 minutes, which, by the way, I don't know.
I don't think
Linda-
you've ever had a 15-minute
The lovely
consultation.
Linda says she would like to hold court on how often I have a 15-minute conversation, consultation. I said, yeah, you're right. She said, because I'm betting that it doesn't. You aren't. Okay. I said, I know. So the bottom line is that what we do is at that point, I really can get a sense of what it is brought you to me, why you're coming, and if you have any of your records or whatever. I'm talking about recent records, not all the way back, not the archaeology, because we can't get into that till you're a patient, but the fundamental things as to why you're coming to see me. So that's important, because I also want to get a feeling of what it is you want to accomplish by visiting us. Everybody's really mindset about what is quality of life, John, is different. Your quality of life is different than mine. For example, you want to be out there on the field watching the Eagles game. I don't, okay? I might want to go for a walk, though, in this weather. You follow me?
Yes.
But the idea is I want to make people feel good enough to do that regardless of their underlying condition.
I have to say, we're talking about patients and so on. You are always thinking.
Oh, yeah.
And
Yep.
you walk into the clinic, and I see you talking to everybody, and I'm saying, I wonder who she's thinking about while she's talking to this one. And it's a constant study.
Right.
How do you do that?
Well, I do it in that I can compartmentalize patients. You know what Linda said to me the other day? Hey, Molly, you know so-and-so. I said, wait a minute, tell me again. Now, doesn't he have this condition? Because I know everybody by condition first, right? You heard me say that.
Yes.
I said, I know everybody by condition first and their name second. But the point I'm making is you've got, I think the thing that really makes us different than a lot of other primary care facilities in that we approach this in a way that's really compartmentalized, in that we know that how we deliver the nutraceuticals can absolutely help effectuate the change, because you can't do that with natural products if you don't get the right constituent from the product and at the therapeutic level. And that is why they've tended to have a bad rap.
And your protocols are unique
Yes,
to you
that's
and
right.
to your clinic.
Everybody's different, and every protocol, there are nuances. Yeah, sure, there's been protocols out since the 40s, okay? Chelation being one of them, because they used to use that for lead poisoning, right? But the variations in those are ours. And I got to tell you, they are still unique to each and every patient.
And when you talk about the unique factors,
Yeah.
give me some idea of.
What? Okay, so for example, if you go into a clinic that just does high-dose vitamin C, you're getting a age-old recipe for the vitamin C. Well, that may not be enough for you. Yeah, you need the vitamin C. Maybe you have some liver dysfunction, so I might need to add some glutathione to that. I may need to look at some other things to add into some homeopathics. Really, it's going to depend on our conversation, what it is you want to accomplish. And, indeed, with our cancer patients, for example, I'm thrilled when they come back to me and say, guess what, our scans were great. But I'm also interested when our scans aren't so great. Where are the new spots? What's going on? Because that can change the recipe of what we're doing, right? It may also mean that I need to consult with my consulting oncologist. So these are the things that we look at when we're doing something for a patient.
You're not a spa.
No. We're so far from a spa, I can't tell you. Although we want you to look good too. It's not good enough. Although, who says one of my nurses, I think it's Linda, says it's better to look good than feel good. I subscribe to the fact that I want you to look good and feel good.
And you do. How many treatments should people expect initially to start?
I think most people need to come in for at least 10 treatments, and somewhere between 5 and 10 weeks. If they come in once a week, they start to feel the difference. But again, that's going to depend on the seriousness of your challenge, the seriousness of your metabolics, right? What's going on with the testing, etc. And where do we want to accomplish this? And so, for example, I have a patient right now who's referred to me from an oncologist who is my consulting oncologist, who was doing very, very well with him. But he said, I'm very concerned with some of our other metabolics. Can you handle that, Dr. Molly, for me? And I said, of course I can. And so it really depends, John. She's in for more than 10 treatments. She's going to be in for probably 30 to 40.
And there are people in maintenance?
Yes, they go down, of course, once a week. Some people go down to once a month. Some people come in every other week. It really depends on, again, where you are in your continuum of care.
This program is Health Watch. We're here every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. The number here in the studio, 855-839-1210. That's 855-839-1210. You know what we always say at this point in the show. Call early so we have plenty of time to get to your condition or your problem or whatever it is you want to ask Dr. Molly. 855-839-1210. With Dr. Molly, I'm John DeMasi. We are both returning to today's Health Watch after these words. We are back here on Health Watch, and as always, operators standing by at Innovative Medical Associates. And the number, 856-489-0505. That's 856-489-0505. And when you call, look, it's simple. You schedule that appointment. It's a complimentary consultation with Dr. Molly. You can get a lot of your issues potentially resolved, or at least you get a direction at that point. So call 856-489-0505. Operators are standing by, and they will kind of set you up with that appointment with Dr. Molly, the initial consultation. And the website, innovativemedicalassociates.com. It is constantly updated, so if you saw it last week, you want to see it this week. Innovativemedicalassociates.com is the website. Health Watch is the show every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Our number here in the studio, 855-839-1210. Dr. Molly always comes up with something that we don't know about. Metabolic syndrome?
Right. Metabolic syndrome versus metabolic disorders.
Now, that's two different things.
Yes. But usually metabolic syndrome leads to many of the metabolic disorders. So I guess we got to start with what really is metabolism, right? So metabolism is the fact that is breaking down of food in a highly regulated manner. In other words, the body's processing your food all the time into simpler components like proteins, like carbs, like fats. And then these things are broken down through enzymatics, and they're broken down even into nanoparticles, all right? So what happens when there's a dysregulation in the metabolics becomes metabolic syndrome. But what contributes to that, okay? And then the metabolic syndrome contributes to a bunch of conditions which people all know about: diabetes, high lipids, osteoporosis, disorders of oxidative stress. There are some people in the, let's say, holistic realm that believe cancer is a metabolic oxidative stress disorder. Now, traditional physicians may not exactly believe that, but they know that the metabolics contributes to diseases. So here we go. What are the telltale signs of metabolic syndrome? Well, the first one is large waist. Okay, you have a little paunch in your belly, all right? We've all seen that. And in particular, Dr. Molly understands that because when we age a little bit, that's what happens, right? But we have to be careful about that. Higher fasting blood sugar numbers. Again, this is the metabolics I look at in the laboratory. Now, there are people who have a paunch in their abdomen and don't have the high blood sugar, okay? But they have one condition to the metabolic syndrome, right? They may have low HDL, which we know is the protective cholesterol, right? We know about that. they have a family history maybe of diabetes or hyperlipidemia, which is high cholesterol. For women, they may come in looking like they have polycystic ovary syndrome, which is a very unique syndrome, but is clearly, I've had patients who've had this and have left that untreated. And the other thing is, some foods actually slow down our metabolics and contribute to the syndrome. Is that unbelievable?
Wow, that's incredible.
So what does do that? Well, guess what? Diet soda. Diet soda.
Well, I guess I'm going to stop drinking that.
Artificial sweeteners in the diet soda. How about fake and processed foods? You know how much these fast food consumptions has led to the most unhealthy incidence of metabolic syndrome in the country. We are one of the leaders in this. Isn't that unbelievable?
That's really
okay.
I can believe it.
Okay.
But it's just something that you do and you don't think about.
Right. How about trans fatty acids? Okay, they're found in foods that are hydrogenated oils, fats, margarine. Baked goods like cookies, cakes, pastries, pies,
all the
everything
good stuff.
we love, right? How about refined sugar? Refined sugars. And guess what? Refined sugar is really been one of the major culprits when we've seen high sugar levels, insulin resistance, which is part of the metabolic syndrome. And sugar, when used to sweeten beverages, is a big problem. So, I have people, listen, one of my own staff members is addicted to Coke, okay?
Yeah.
And she has a twofold problem, okay? Alcohol, if we consume too much alcohol. So these are just some of the things that can lead to the metabolic syndrome. But what can we do about this? Well, what we have to do is address the underlying conditions. Like, I need to know, what's your diet like? What's your exercise regime like? Is there a way to link this and help you actually use medical hydration to help you lick the syndrome? Well, there is. There's actually several articles and evidence linking hydration to metabolic health. Now, why do you think that? I can tell you why. Because in medical hydration, in a place like we do, real medical hydration, you're getting the breakdown of the micronutrients that the body needs to hold what culprit I always talk about? Inflammation.
Yes.
Thank you, John. Thank you. And that is something, because we have to get to the bioactive natural sources. In other words, the extracts, the peptides. Everybody right now is all hipped up on collagen, right? Collagen is the newest peptide out there, but it's not the only peptide. And these peptides are very, very important because they're small microparticles, nanoparticles. And you're able to really do this with certain medical hydration. So now we move from the syndrome. If you've abused your body, now we've moved into the actual disorder. I see a lot of diabetes, right? A lot.
I'm one of them.
Okay, a lot. And what do we have to look at? High oxidative stress. And you were a really good candidate for that. Based on the stress of your job, the way you have to move your day. In other words, when you're doing radio shows, you may be on Saturday morning at 6 a.m. You may be on again at 6 o'clock p.m. I mean, there's so many things that go into this. Don't you think that the body's circadian rhythm is disturbed?
Yes.
So that I see a lot of. So what we have to do is be aware of the patient's habits as well. But did you know that there are so many extracts that can help diabetics? Natural extracts.
I didn't know that.
Okay. Well, you're getting them
I guess
every
I
week.
guess.
That's why your blood sugar has been so good.
Right.
Right? So there are so many things that we can use. And several of them are actually extracts that are all anti-inflammatory, including your dear friend vitamin C.
Yeah.
What we want to do is use a vitamin C extract that has less sugar. And when we talk about sugar in a clinic like ours, we're talking about both complex carbs as well as simple sugars. Being the simple sugars, the raw sugar, the refined sugar is bad. But you also eat fruit, so we have to worry about that. And what we do by utilizing fruit extracts that we use and utilizing natural extracts that I use, we're really utilizing the underlying constituent that changes the body's metabolism.
Now, you're not saying, you said earlier, cookies and all of this good stuff.
Right.
You're not saying to cut it out completely.
No, I'm saying
just in moderation, right?
I'm saying, get in my chair.
Yeah.
Yes.
So I guess what I'm doing is right.
It is right.
Because this metabolic disorder wouldn't happen if I'm doing the hydration, correct?
Right. Well, it may not happen. It depends. Again, there's.
But I'm doing something to prevent it from happening.
Right. But one of the things you've done is you started in my clinic with a metabolic syndrome.
Yes.
That was this issue. And then we really discovered you had the diabetes, which happens because the syndrome can lead to these conditions. It's the other way around, John. The syndrome leads to the conditions, okay?
Yes.
Which is diabetes, high lipids, which then leads to cardiac problems, right? Then we have osteoporosis. That's another one. And all of the disorders that come about from high inflammation and oxidative stress.
So the conclusion would be, let's say you're the doctor, so I'm not.
Well, I'm not
the
medical
PhD.
doctor.
You're the PhD
I am the
doctor.
scientist
You're
doctor.
the scientist.
Yeah.
So the conclusion would be the hydration to prevent any metabolic disorder.
Right. So if people get in earlier, right, and we help them lose the weight, which we're doing, and we're having great success. I had a patient call me yesterday and said, Molly, you're not going to believe this. I lost 2.5 inches on my hips and in my abdomen following what you said and following the medical hydration. I said, Tina, we love you. That's all I could say. You're doing what I ask you to do.
And would this hold true for most of the patients or for some of the patients?
Many of the patients. But again, it's not holy water. You got to do some things at home. You got to, if we're looking at reducing, your waist size, what do we have to do? We have to look at portion control. But I'm not the food police. So we're not going to tell you, don't eat a cup of pasta. What we're going to say is, why don't we look at pasta as carb loaded? But you're not going to do pasta 7 days a week.
No,
you're not going to do, maybe you're not going to do a filet mignon 7 days a week either. Even though I love proteins, I think they're important. So the idea is you want to help a patient where they are, not do a universal thing. This is why I think diets fail. Now, I lost 35 pounds, and you can see that in me.
Yes.
Well, on top of that, I have a nurse. She's on it, Nurse Donna. She lost 30 pounds, okay, doing this. Now, she, though, follows a completely different exercise protocol than I do, which is good for her age. She's a little younger than me, right? About 15 years younger than me.
Yes.
So she's over there at the gym working out. That's great, But I like to walk. I wouldn't give up the walking. I think the walking has contributed to the weight loss. Tina, on the other hand, I think has to glide into this because she's been sedentary for so long.
So it really depends on the situation.
Right, and on the patient. But I can tell you this, that many of the nutraceuticals that we are able to deliver in our protocols, including our vitamin C, extracted from things like cassava, tapioca, more in terms of traditional extractions like from citrus, but how you utilize those. Looking at some other things that can help us. Grapeseed extract is another one, highly anti-inflammatory, right? So lecithin, and it's an interesting thing because when I'm using lecithin, I'm really looking at something that is an indole 3-carbinol, which I use also in the cancer protocols for women. So you can see it's a little complex.
Yes.
John.
We're going to pick that up after the break. It's the halfway point of the show. Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is our number here in the studio, 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We want to hear from you. If you have a question or a medical challenge you want to run by Dr. Molly, again, 855-839-1210. We both return to today's edition of Health Watch after these words.
This program is paid for by Innovative Medical Associates.
We are back here on Health Watch. Operators standing by right now at Innovative Medical Associates, 856-489-0505. That is the number. when you call, you want to make that appointment with Dr. Molly. The initial consultation, complimentary, 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. Check out the website as well. A lot of good stuff on there. Health Watch is the program every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. The number here in the studio, 855-839-1210, 855-839-1210. Wrapping up this segment on medical hydration for metabolic health.
Right.
What did you want to tell us,
Well,
Dr. Molly?
I think I want to say that what we have to realize is that the problem with the metabolic syndrome is it can easily slide into these metabolic disorders, which can be really devastating. For women, the osteoporosis in particular, if we utilize the medical hydration, utilizing some natural sources of calcium. By the way, when we were kids, our mothers always told us milk was good for our bones. Why? Because of the calcium.
Yeah.
And again, the micronutrients of calcium are the thing when you can deliver them by medical hydration, along with vitamin D. So here's the deal, folks. I think we have to look at metabolic syndrome as a precursor to much more serious types of conditions. And we want to utilize all of God's ingredients like the quercetin, the lycopene, the glutathione. We want to look at things like holy basil. We want to look at things like natural occurring enzymes that we use in the gut. We got to clean up the gut. The gut health is very important. Sometimes there are other things that we want to use in this. And again, our particular protocols are going to depend on where you are in your continuum of metabolic syndrome. Because if you're just starting a metabolic syndrome, guess what? You have a great opportunity to change your life around and never, ever get diabetes regardless of the genetics, because our genetics don't necessarily mean we have to have the problem. You've heard me say that forever. And I think if we do this and we look at God's given nutraceuticals, plant-derived compounds, other compounds as therapeutic tools in addition to, let's say, drugs, remembering that the natural substances are smaller and their risk of adverse effects are going to be minimal, John. I think people will do better in the long run.
Is there such a thing as preventive maintenance in this?
Oh, yes, absolutely. If you come early enough, we certainly can do this and get the bioactive ingredients into your IV early on. And guess what? I have seen people turn around. I have seen people's hemoglobin A1C that at 6, you're a diabetic. I've seen them at 8 go down to 5.5 and maintain their diabetes at bay by just changing diet and coming in for a maintenance with us. And I can tell you, I have the proof. I can show you the laboratory proof for that. That's a big deal.
So it would pay to come in.
Yes, earlier the better. And I talk about that all the time, right?
Yes.
Earlier the better, the more effectuated change we can do. And I tell people it's really a question of being I guess, thinking about each and every condition and how it affects you and what can you do to change this and really maintain your quality of life. That is the key. We have to be myopic. In other words, for each individual patient, that's the myop I'm talking about.
All right, 855-839-1210. That's the number here in the studio, 855-839-1210. Another fascinating story of a patient that Dr. Molly has. He's currently a patient.
Yes, he's coming in today. He's coming in today through all the snow in the Midwest, I'll tell you that.
And I said earlier that Dr. Molly is always thinking not about just the patients on the floor, but other patients who aren't there. I mean, your wheels are always turning.
Well,
so this particular patient, this story is so fascinating.
it is.
And how you uncovered this when, of course, nobody else did.
Well, no, with the help of my physicians. I mean, bottom line is I'm not a physician, but, when you put all the data together, you got to look at this scientifically and medically. And I think working with my docs has been an interesting phenomena for them as well as for me. because I really look at things like the scientist I am. I look at their metabolics, actually, the quantitative data that I see. So this young man, he's 34 years old. He has 3 kids. Wonderful young guy. He has a family business. He's in a family business that they are in concrete, and they live in Indiana, and they do a lot of different kinds of concrete pour in all kinds of farming type situations. So they're in, and with livestock and that kind of thing. So you got to understand, you also have to think about, where does the patient come from? I'm saying geographically for many things. For example, when you're looking for parasites, right? We have parasites here in this country, meaning in our area in New Jersey, that maybe they don't have in Indiana, but they also have parasites in Indiana that they don't have here in Jersey. So again, even when you send out for their laboratory, you have to be specific in saying regionally. What are you looking for regionally? And that's from the laboratory point of view. And also, I've got to take in the fact that patients are coming in, and we need to talk to them about their laboratory data. If we see something in the laboratory data that sort of leads me down one road. So in this patient, he was doing very well. He had a lot of nutritional deficiencies. Many. He came in, he's skin and bones. I think you saw him.
Yeah, I did see him, yeah.
Wonderful young man. Wonderful. His wife was very, very worried. His mother and father were worried. And he was treated in his hometown by several physicians, including infectious disease, including primary care, including endocrine. They said there was nothing wrong, that he was just anxiety-ridden, yada, yada, yada. Well, it comes to me. His first set of treatments with me, 2 weeks long. And, I did pretty well. I got his iron level up. I got all of the nutritional things somewhat on the right path. He goes back home. Now, he's been home for, I think, 6 weeks. His wife calls and said, Molly, he's just not right. I decide to rerun some of the testing that I ran before that came back negative. Okay, this goes to show you that you just don't go by one test. So I started to run things like blood cultures. And in blood cultures, I'm looking for bacteria that may be contributing to his condition. I discussed it with Dr. Pat, who said, yeah, you're right, but don't you think that's looking for pink elephants, and maybe we shouldn't? I said, well, she said, but you know what? His symptomatology of the fevers and all, and she goes on and on, you might be onto something. Let's do it. So we do it. They came back all negative again. So in talking to my doctors, I said, guys, I'm thinking that there's something going on here. What is it? What am I missing? And what are we missing? Well, I don't know. Maybe the first guy was right. You hear all of that, and they talk to their colleagues and they say, come on, let's just get him metabolically back in shape and he'll be okay. I said, nah, but this slide back bothers me. I said, I think I'd like to order mycology. Now, mycology looks for fungus and yeast and that kind of thing. And women are very familiar with this because women tend to have, many times have yeast infections. We know this. But it usually affects just a particular genitalia organ or something like that. Very rarely. Well, I sent out for a blood study in mycology. So now this is while he's still in Indiana. So you can understand that we're talking on the phone and we're doing a phone consult with the docs and myself. And I said, what do you think, Doc? And she said, yeah, go ahead, Molly. What's the problem? He said, okay, I'll go to the lab. I said, now it's very important that you use the conventional lab because I want to be able to do the follow-up right here. So we're not sending out to all these fancy labs that are going to charge them $10,000. We sent it out to LabCorp and Quest, right? Because they're universal, they're everywhere, from coast to coast. Because I want to be able to match apples to apples, right? You don't get data from one and try to match it to another. Bad science, right? That's called junk science, John. So, garbage in, garbage out. So, I'm looking at this, and I send them out. Now, it takes 3 weeks for the mycology to come back. I'll be darned. He had candida.
And what is that?
Candida is a yeast / fungus, okay? So he had candida in the blood. The very next day, I get a call from a pathology associate of mine because I send it out to him to just look at a doc who majors in pathology. He's a lab director. Calls me back. He said, hey, Mal. and this was a guy I sort of think of as a mentor in my business. He said, "Mom, you know what?" He said, "In all my 20-some years," he goes, "I've only seen 3 cases of this, and that was in hospitalized patients." He goes, "You're catching this early, and it's really Candida." I said, "I
How
think
about
so."
that? How about
So
that?
now that changes how I'm going to treat it.
Okay, we
Okay,
hate to make you stop right there.
Okay.
But we're coming up on a break, and we have a call. We're going to talk to John in Mount Laurel,
Okay.
and maybe we'll talk to you at 855-839-1210. That's 855-839-1210. The show is Health Watch. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. I'm your host, John DeMasi. We're both coming back with more of today's Health Watch after these words. We are back here on Health Watch. 856-489-0505 is the number. Operators standing by right now at Innovative Medical Associates. 856-489-0505. Again, that's the number you call. You make your appointment for the initial consultation. It is complimentary, but you really do find out a lot in that initial consultation. And as Dr. Molly said before, the next time she does a 15-minute consultation will be the first. 856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget, if you miss any of today's show, we replay it 4 to 5 this afternoon, the Health Watch replay for those of you who may like to sleep in a little bit. It's the Health Watch replay 4 to 5 this afternoon here on Talk Radio 1210 WPHT. We're going to go to the phones right now. John in Mount Laurel. John, good morning.
John.
Welcome.
That's my favorite
Dr.
patient.
Molly and John, how you guys doing?
Good.
How
man.
you doing?
You're our favorite patient.
Well, I'm listening to you guys talk about the bacterial infections.
Yes.
And as you know, that's what supposedly I had on my skin, a bacterial infection because of this rash. And I don't know, what do you do? How do you get rid of this? I mean, it's just unbelievable. They put me on Dexilent, a shot that I take every 2 weeks.
Right.
It has knocked the hell out of it. It's 99% gone.
Good.
But the other day, it broke out on my arm. I was supposed to come in Wednesday for infusion. I come every Wednesday. And it just, my whole arm was covered with it. And I thought, I don't want to break the skin there with whatever's going on.
No, you did right. You did right, John.
So I
did. You did right.
I called Linda and I had canceled out.
Right,
but
right.
Now, this Dexilent.
Yeah.
I don't know, what's it supposed to do? Get rid of bacterial infection or what?
I think it's actually now you got this from your infectious disease person, right? Is that right? Or from the
dermatologist?
From the dermatologist, yes.
Yes. She did the test and she cut a piece out of my chest, and it was whatever.
This particular thing, yeah. It's supposed to take care of it, but here's the problem: is just what I was going to get into about this poor guy in the Candida. The problem is you've got to make sure you've got to use this thing until it clears it up, and unfortunately, metabolically, it depends on where you are. In other words, for some people, it may clear it up with one shot, and for others, it's going to take a little longer. So that becomes a particular thing that the doctor has to make a medical decision about. So, for example,
so it could be extended. Extend the period of time.
Correct. So it's terrible, but it's true, John. So, for example, this young man who's coming in, he needs 8 IV treatments of an antifungal. I mean, that's the best that between Pat and myself talking, she thinks we're going to need at least 6, but possibly 8 in order to help eradicate it. And that doesn't mean he can't get it again, because these kinds of things like they're doing for you can hide, my friend. Hide. Now, he has a totally different thing.
This is what they're saying.
Yeah, and he has a totally different thing, okay? But it can be. But one thing I will tell you, the fact that you're so very, very, I would say, you get on top of your condition and you're proactive so quickly, that is in your favor, as well as coming in for the anti-inflammatories. That is very, very good, and it should help us keep it further apart from you, John. So that's really the key to this.
Is that what we're going? Is that what you intend to do? Like, did they go into it for the anti-inflammatory for me?
Yes, because I don't want your body to go into the inflammatory crisis again. So that's what we're trying to do for you, okay? And I think that's fundamentally what I'm going to do for this young man. But he, by the way, he's only 34. John, you're like 24 compared to his 34.
Wow.
Yeah, you understand why?
Wow.
I'm talking about your nutritional status, okay? That's why I think you ultimately get rid of this thing fairly quickly, even though you're like, a little bit older. All right, John? God bless you, my friend.
Right.
Thanks for the call.
Thanks for the call.
See you Wednesday.
Okay.
Thank you, buddy.
Good luck with that, John.
You. So you know what I'm saying there, John. So in this case, this gentleman is going to need a course of conventional medical hydration therapy with a drug, as well as what we do in terms of maintaining his nutritional status, maintaining the antioxidant status, giving him a boost in his immune system while we're doing this, and hopefully altogether that should work.
How long do you think this treatment is going to go?
He's going to be with me at least 2 weeks. I said a full 10 to 15 days.
And he will be treated every day?
Yes. Every day. We're coming in Saturday and Sunday.
And do you think at the end of the 2 weeks, then you'll have a handle on it, or
I think
what?
we'll have him. We'll repeat the test. We'll send him home because he's going to be feeling so much better. I'm telling you. Wait. And I think then we continue with all the anti-inflammatories, the antioxidant levels. We got to continue his nutritional status. I want to check his iron. By the way, this is something for women out there who have these yeast infections. Do you know that this diflucan really loves to devour iron? Okay? Iron.
Wow.
And that was interesting because that was one of the analytes I circled, and Dr. Pat said, well, that's pretty interesting, but I'm not quite sure. And I said, read about these yeast infections there's some preliminary data about that, and I think it's worth holding on to.
It goes to show you that many, many times people come to you and they haven't a clue as to what's wrong with them.
That's exactly right.
And you've actually discovered this.
Well,
Here's another story.
You try. We try to do the best we can, and we want to work with their conventional practitioner. Don't misunderstand me. It isn't like, again, I'm going to say this isn't holy water, but there's a certain amount of doing the archaeology on the particular person's lab work, etc., going all the way back, putting together the whole process, looking at that and saying, oh, look at where he was 3 months ago, looking at where he is now, and putting all this data together. You got to really compute the data, John.
Guess what?
Oh, no.
We're out of time.
All right.
And with that, we put the wraps on another edition of Health Watch. Don't forget, Dr. Molly is available during the week, 856-489-0505. The operators will be there well after we leave you at 9 o'clock, 856-489-0505. Call and make that appointment. You can do it after 9. You can do it after 10, whatever, but make sure you do it. 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget our Health Watch replay, 4 to 5 this afternoon. And with that, we put the wraps on another edition of Health Watch for Dr. Molly Fantasia and everyone at Innovative Medical Associates. The lovely Linda, Barbara, our nursing staff, Barbara, Lana, Donna, Vicky, and Daniel. And, of course, there's Joanne, delightful Dee, fabulous Fran, and our medical assistant, Sandra. I'm John DeMasi. Thanks for listening. We'll talk to you next Sunday, 8 till 9, here on Talk Radio 1210 WPHT. Stay tuned for a new program called The Heart of Your Money. Oh, it's going to be a good one. Talk to you next week.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.